divide impressions into two categories, anatomic impressions and functional impressions. When you're recording the impressions under a functional occlusal load, then that's what is known as a functional impression. Anatomic impressions, you can make an alginate impression, you can make an elastomeric impression, you evaluate the impression, and you pour a master cast. That's typically an anatomic impression. But what's a functional impression? There are various techniques. You divide them into functional impression techniques and selective pressure. McLean's, Hindel's, functional reninding method and fluid wax fall under the functional impression techniques. And then you have a selective pressure, which is according to the choice of functional impression materials that you are using. So that's your broad classification. This is the diagrammatic representation of McLean's technique, wherein McLean was the one who made wax occlusal rims. He applied pressure on the wax occlusal rims and he made an impression and then he picked it up in an alginate impression. However, Hindel's felt that if you're going to just pick it up with an alginate impression, then how are we going to maintain that load that we are applying? So what did he do? He modified. He modified the tray and made holes in the tray. So when he made holes in the tray, it was very easy for applying pressure throughout the pickup impression as well. So that's the Hindel's modification of McLean's technique. Draw your diagrams because your diagrams are the ones which will give clarity of your understanding, and that's why I'm explaining you as well with the help of diagrams. Functional relining. Now, what do we do in functional relining? There's no tray or anything. You have to have your entire framework. Over your framework, you outline. Then as you see on your right, you adapt a spacer here. You make a tray then after the spacer. Then you do the border molding. And then finally, you do your functional impression with the type of mouth temperature waxes or with selective pressure. As I told you, you use zinc oxide eugenol impression paste, non-eugenol paste, or light body elastomers. So when you're using the entire framework, then it's either a functional relining technique or your selective pressure impression technique, depending on the type of materials you're using. What are mouth temperature waxes? Mouth temperature waxes are the ones which remain fluid in the mouth temperature, and moment they are removed out of the mouth, they harden. So these are called as functional waxes. They are very, very commonly used in functional relining techniques or selective pressure impression techniques for functional impressions. This is the altered cast technique. Again, very, very important. The diagram says it all. So as you can see that this on the left is your framework, which is fitted on the master cast. That is diagram number 1. I'm going to be tick marking. Then this is how you delineate that this is what I don't want now because this is my anatomic portion of my cast. So this I'm going to remove. So this is how my cast looks like now. That this is the cast that I've modified and I've made retention grooves over which now I have secured my framework. I've made my tray. I've made my impression now, and finally I've poured my impression again. So remember, altered cast technique is a lab procedure of making your combination of anatomic and functional cast. It's not an impression technique. Your impression techniques are all those which I discussed previously, but your modification of your cast is your altered cast technique. Again, very, 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 very important. Must read, must draw diagrams.